Can artificial intelligence, that is AI, replace doctors? Now we know that AI is entering into almost every field, and many fields they depend partly or fully on artificial intelligence. And we know that in the future, this involvement of AI into various fields will only increase, and medical field is no exception. So in medical field also AI is slowly entering into various parts, and so always this question is asked whether AI can replace doctors in the future. So if you look at what are the roles that AI can play currently in the healthcare. So number one is that definitely if you put the symptoms and the examination findings and investigation reports in the chat GPT or other similar platforms, then it can come up with likely diagnostic possibilities and how we should investigate further and what are the lines of treatment, because it quickly searches the literature or the evidence from published studies, and it can give a concise summary. So definitely it can be helpful for a doctor in terms of making a correct diagnosis, deciding the correct treatment plan, because we also know that there are multiple medical journals, and it is not easy for a doctor to keep updated through all the journals that are getting published. Every day we have new articles, but their chat GPT or similar AI platforms can be handy. So a doctor can browse the latest in each area, each disease or each treatment through with the help of chat GPT or other AI platforms easily, and he can get the recent update. Now definitely there are some things only doctors can do. If you look at, say, surgeries, so AI at the moment cannot perform surgeries. We have use of robots which can help a surgeon to perform surgery, but a robot without the surgeon cannot perform a surgery. So any surgical procedure, definitely a doctor is needed. Again, if you look at clinical examination, so doctors or the medical profession is a clinical specialty. So along with the history, we need to examine the patient. So for examination, a doctor is required to find out the abnormal findings and then the correlation. And also not to forget, medical profession it requires human touch. There is an element of empathy, emotions, giving reassurance, discussing the pros and cons of various treatment options, guiding the patient if there are possible side effects or adverse effects of any medication or surgical treatments. So most of these things require a human touch and human interaction, which is not possible at the moment with the use of AI or any other chat GPT or any other such chat bots. So what I would like to say, and also there are many procedures. If you look at, say, diagnostic procedures, say doing a biopsy or any interventions, starting an IV line or any central venous line, intubation. So many such procedures in the ICUs or the wards also require doctors' help. If you look at cardiology, for example, so doing coronary angiography or putting a stent, so many such procedures we need the trained doctors to perform them. So definitely, as you can see that AI can help doctors in their work, and doctors who use AI in their routine practice will be better doctors. They'll be able to keep updated with the latest medical information. And also sometimes if you are not sure, because many times we have new medications and new treatments they are being discovered every week or every month. So some of those things may be totally new, which may not have come to your city. So with the help of latest browsing of the internet and using AI, a doctor can get the latest updates, and then it can help him in his practice also. So one thing we have to remember is that doctors need AI. We cannot separate the two, and doctors who use AI will be better doctors. And at the moment, or even in the near future, we do not see that AI will replace the doctors.